sure everyone has one of these, as everyone has their plaque index and their toothbrushing and flossing handouts.
Everybody have one of these?
Everyone has both. Can you all see the screen? Everyone's good, comfortable.
Can you get up and move up a little more or no? Okay, next too far back. Okay, everyone take a step back. Just we have to be back. Okay, everyone, someone here. Somebody be too far back. You have to get closer.
Okay. Everyone's good? Everyone's comfortable? Everyone can see? It can't be moved up. But you're good? Okay. So basically today we're going to be going over disclosing agents, how to brush using the best technique of brushing, and how to floss. So you guys probably don't know what disclosing is. What is disclosing? It's something you're going to do to your patients, and you're going to have to fill out this assessment sheet. So what disclosing is, we're going to go into it in more detail, but just to give you like the simplest explanation of it is, basically you're going to apply a dye to the patient's teeth, and the dye, it's going to get absorbed into the plaque. So the type of dye that we have here in the clinic, it's a dual tone. So it turns pink and purple, the one that we have. When it turns purple, that means that the plaque has been sitting there for a long time. It can be either plaque or calculus. Calculus is the harder type of plaque that's been mineralized over a while. And then plaque is the soft. The pink one, it's bacteria that's new, it's fresh. So when it's pink, that means the plaque hasn't been sitting there for a while. When it's purple, it means it's been sitting there for a long time. So when it's purple, that means that the patient has to concentrate on that area. More concentration has to be placed on that area. And we're going to go over brushing, and we're going to go over flossing. So brushing and flossing, patient education is a huge topic. So today's lecture is just the basics. When you go into the lecture with Professor Spencer, she's going to go over everything else. It's a huge, huge topic. Why wouldn't my lecture today be enough? If I showed you how to brush, how to floss, why can't you just be like, go to every single patient, this is how you brush, this is how you floss, next, this is how you brush, this is how you floss, next. What makes me different from her, from you? What makes everyone different from each other?
What you learn?
What else? Besides the fact, like say I have more plaque than you, the way people's teeth are, what's different about people's teeth? What makes your teeth different than my teeth? What can you have in your mouth that's different than my mouth? Crowding, pockets, what else? What can you have? Replacement teeth. What kind of replacement teeth? Restorative, bridges, crowns. Some people can have veneers. Some people can have bridges. Some people can have crowns. Some patients can be children. If you give a patient education instruction to a pregnant lady, her instruction is going to be different than a child, than a geriatric patient, than an older patient. Some patient education is going to be different than someone who has dexterity issues. Dexterity, some people's hands shake. Some people's hands, they have arthritis. They can't really hold the toothbrush that well. So in Professor Spencer's lecture, you're going to learn how to give the patient education specifically to each patient. And the patients are really going to appreciate you. Because say a patient has a bridge, for example. There's no advertisements on TV that show what a floss threader or a bridge threader is. They're going to tell you, oh my God, I didn't know that there was something that can clean underneath my bridge. They're going to tell you thank you for telling this, because there's advertisements only for toothbrushes and toothpaste or whitening. They don't know what's out there. So that's what they have you for, and they're really going to be thankful and appreciate that you're going to cater your patient education specific to their needs. So each patient that you're going to have, you're going to give them a completely different lecture than the next patient you're going to have. Okay? Okay. So something else I want to just mention to you guys. When you guys are giving your patient education, you guys have to have, obviously, your masks off. And when patients are looking at you and you're giving your instruction, they're not going to be looking at your eyes. Where do you think they're going to be looking at you when you're talking? At your teeth. So please make sure your breath is fresh, your teeth are clean, because they're going to be staring at you guys. So make sure that you look good, because you're going to be educating them. And if you just ate a sandwich or something, and there's something stuck in your teeth, you know, they're like, why are you telling me this? Okay, so let's get into disclosing. So the purpose of disclosing is it demarcates soft deposit. So what that means is that it differentiates the soft deposit from the clean tooth. So the dye is only going to dye, it's only going to stain the soft deposit. And where the tooth is clean, the dye isn't going to attach to that. And what this does, it does personalization of patient instruction. So each patient obviously is going to dye different parts of their teeth. Not every patient's teeth are going to be dyed the same way. And this is also a self-assessment technique for the patient. They can see the areas that they need to focus on more, where they need to brush, especially the areas that are dyed purple. You have to tell them you have to focus on these areas more, and then to go over the pink areas as well. Some areas won't even dye pink or purple. So I just want to show you. This is only one type of dye. This is just pink, but ours turns pink and purple. So if you guys want to look at that, if you guys want to pass it around. And this is also can be used as a continuing evaluation. So I'm going to go over this sheet later, but say you were to fill it out and they would have a certain percentage, say like 30% plaque score. The next time they would come in, say 6 months from now, their recall, you would do it, you would disclose them again, and you would compare. Were they listening to your patient education? Did they get better? Did their scores decrease? Did they increase? Did they remain the same? So it's good for you guys to compare to them and for them to assess themselves. Are they doing any better? So this can also be used for research studies. Now the properties of an acceptable agent. The intensity of the color, if it absorbs into the plaque. Sometimes you don't want it to be too light. You want to make sure you're able to see it. The duration of the intensity. You don't want it to stay too long in the teeth. You want to be able to have the patient brush it off. You don't want it to go away too quickly. The taste, you don't want it to be a dye that the patient won't feel comfortable. It bothers the patient or irritates the gums. The way it diffuses, and if it has astringent and antiseptic properties. Now these are different types of disclosing agents. The first one, iodine Skinner solution. We don't use that because patients sometimes are either allergic to iodine or they're either sensitive. And the other few are other types of disclosing agents. The ones that we use here in the clinic, the one that you should know is the two-tone FD&C green and red. That's the one that we use here because ours is two-tone, pink and purple. It's going to be, I was going to show you guys later, but it looks like this. It looks like a Q-tip, and it's purple inside. And then we're going to break it off. I'll show you after, but this is what it is. So the method of application, what we're going to do is there's 3 different types of ways depending on the disclosing dye. The one that we have is painting application using this. It looks like a Q-tip. So the first thing that you're going to do is they're going to give you either Vaseline, and you're going to put the Vaseline on the patient's lips. You're going to put it on any crowns, any bridge work, any veneers, any bonding, because you don't want the dye to get absorbed into their restorative work. So you have to make sure you use another Q-tip to apply it. Use the Vaseline, because you don't want it to stain their teeth, their work, because then they'll be upset with you, okay? So you do the lips, and then you do the restorative work. After that, you're going to ask the patient, you're going to have the patient rinse out, remove any debris, and you're going to apply the lubricant. You're going to dry the teeth, and then you're going to use this to paint the teeth. So what you're going to do, there's a little purple line here, so you're just going to snap it off. But the thing is that you have to be careful is when you snap this off, it drips. So if this drips onto the floor, Carol's not going to be happy. So be very careful when you break it off. and you're going to apply the solution. It says generously to the crowns. When it says crowns, it doesn't mean restorative crowns. It means the clinical crown in the mouth. So don't apply it generously on, on crown work. And then sometimes you can tell the patient to just use their tongue and just go like that, just to spread it around. And then you're going to examine it. Another type of, besides this way, that they have of disclosing agent, they have rinses. And it's like it's like food coloring. You put it in a few drops into some water, and then they swish it around, and then it stings the teeth. And then another type is just a tablet that they can chew, and that also discloses the teeth. And this is just the same picture that I showed you. Okay, now this part you have to pay attention to. This is what you're going to be doing in clinic. So everyone take out your plaque index. And you can't really see it that clear up there, so just focus on what I'm going to say. The first thing that you're going to do, their teeth are going to be disclosed. So you're going to see purple and pink. So we're just going to pretend it's all one color. They're not going to differentiate between the purple and the pink, okay? The first thing that you're going to do when you get this paper is you're going to cross out any missing teeth. So any teeth, you put an X through it. Any teeth that are missing, you're going to put an X through it. The second part you're going to do is any teeth that have any crowns, any bondings, any bridge work. You're not going to dye those, right? So we're going to consider those missing as well. So you're going to put an X through those as if they're missing. So that's very, very important because that'll mess up your percentages. So cross out the missing teeth and cross out any teeth that have bonding. Like some people chip their tooth in the front. You can, if you don't see it, I don't know if you guys know how to identify that, but ask your patient, do you have any bonding, anything you don't want, any veneers, any bridge work, especially between you guys today, because you're going to be doing it on each other. So you know what's in your mouth, so tell your partner. Okay. The next thing that you're going to do is that in each tooth here, it's split into sections, into 6 sections, which is surfaces, because there's 6 surfaces on the teeth. So there's the buccal, facial, there's the lingual, there's the mesiolingual, there's the distolingual, there's the mesiobuccal, and there's the distobuccal. So when you disclose the teeth, the whole tooth isn't obviously going to be dyed. It's only going to be certain parts of the tooth on the lingual side and on the facial side. So when you put the disclosure, you're going to put it on the buccal side and on the lingual as well. So not each part of the whole tooth isn't going to turn pink. The whole tooth isn't going to turn purple. Some parts of the tooth are going to turn purple. Some parts are going to turn pink. Some teeth won't even have anything on it. Okay? So you're going to take your red pen and you're going to shade in each section. So say the mesial lingual of the first molar had a spot of pink. You're going to shade that in. Say the distal lingual of the second premolar had a spot of pink. Each surface that has been disclosed and shows you pink or purple, you're going to shade it in. You're not going to shade in the whole tooth with a section, each little surface. Okay. After that, we're going to do some math. Okay, after everything's colored, you're going to get the total. First of all, you're going to count the number of teeth present. So what does number of teeth present mean? The number of teeth that are not crossed out. So say I have a patient and they're missing their wisdom teeth only, and which is
1, 6, 17, and 10.
perfect. So there are 4 teeth missing. And say they don't have any bonding and any crowns or any restorative work. So then there's 28 teeth left. So we crossed out the 4 wisdom teeth. So now there's only 28 teeth present. So then we're going to count the total number of parts with plaque. So you're not going to count, now you're going to start counting each red space that you colored in. So say for example, my patient has, if I colored it in like this, I don't know if you can see it. See how I only shaded certain sections of the tooth? I don't know if you can really see it. I'm going to count each little red section, not each tooth, each red section. So if I colored in 23 sections of the mouth, so we're going to do 23, because there's 23 parts or 23 surfaces of the teeth that were that came up to be disclosed. So 23, and then you're going to put that over, then we're going to do 20, there's 28 teeth. So you're going to do first 6 times 28, okay? So you multiply 6 times 28 and say you get 168. And then you're going to do the 23 over 168, and then you multiply that by the 100, and that's the percentage.
Sorry, where does the 6 come from?
You see how it says in the middle of your, look at your chart. It says total number of teeth parts with plaque over 6 times the number of teeth present times 100 equals the percentage of score. So the total number of teeth with plaque, so I counted, there were 23 little red dots that I filled in. And then you do the number of teeth present, which I had 28 because my wisdom teeth were missing. So I just did 6 because you have to multiply whatever teeth present by 6, always. Always multiply by 6. So I would do 6 times 28, get that answer. So then you do 23, which is the number of teeth with plaque, divided by 168, and then you multiply it by 100, and that's the percentage you get. So I would get 13.7%. Does everyone follow? Does anyone have any questions? Yes.
So you would call that 68% plaque?
Plaque index. And that's how much percentage of plaque that they have in their mouth.
Okay.
That's their plaque score. Everyone's okay? Everyone's okay with the math? Everyone understands that you have to shade in the surface, not the whole tooth, and to cross out missing teeth, and to cross out any restorative. You're not going to cross out amalgams. You know the amalgams is the metal filling. You're not going to cross teeth with that out. Only teeth that can be stained, like white composites or.
What is that? The clear filling?
Yeah, the clear filling.
Okay, so then
You're
I
going to
have
cross
to
out,
have
because
that.
sometimes the clear filling goes into the interproximal, it hangs over, so.
Yeah, because I have that. And then
It's in between, yeah, because you don't want, yep.
If they had a false tooth, would you cross that out?
Yeah, the false teeth are crowns or
Oh, okay.
bridges. Okay. Any questions? Go ahead. No? Yes? Okay.
So, can I just quickly,
Yes.
I'm sorry.
Go ahead.
So if there was a white or clear filling, just like in the occlusal surface?
You would cover it with, yes,
Have to clarify, they're not clear fillings, okay?
they're
Make sure we say
white
what-
fillings, composite, white. There's nothing
Colored
clear.
filling.
It's a
Okay.
tooth-colored filling.
So if it was just straight in the,
And you would cover it with the Vaseline,
okay.
and
But
then
could
you
s-
would dye. You would ask the patient. Sometimes they have it hangs over interproximally in between, so
Then you have to cross it out.
you have
But
to
if
cross it out.
doesn't-
If it's just on the occlusal, then you cover it, and then you dye around it.
Great.
Unless the patient really doesn't want you to do it, you ask the patient, can I? If they don't really want you to do it, then just, if they tell you no, then just cross it out, okay? You also don't do that when you guys eventually get up to sealants, and you're gonna have to disclose the child, you don't just put any disclosing on the tooth that's gonna be sealed, but you're gonna learn about that later, so you don't want the dye to get into the cracks that you're gonna seal over eventually.
Wait, I'm sorry. What if you have ceilings right now? Don't do them in the ceiling.
If yes, you're gonna cover it with
Vaseline.
Vaseline. Yep. Okay, patient instruction. You're gonna explain bacterial plaque. You're gonna show the location and distribution, and you're gonna demonstrate the method of daily plaque removal. You're gonna show them how to brush and how to floss and which areas you're gonna focus on. You're gonna explain to them. I know you didn't learn exactly what plaque is yet, but I think this lecture, Professor Spencer is gonna teach you about plaque and everything that's involved with it. And as we said, the hints, avoid using disclosing or antiseptic solutions on teeth that have tooth color restorations. Do not apply a disclosing agent before sealants and gingival assessment. Now, why would we not want to apply disclosing before a gingival assessment? Does anyone know what a gingival assessment is? It's when we look at the gums and we assess if they're pink or they're red, because it's going to affect the color. Exactly. And if you were to buy it, you're going to buy it in small amounts because it evaporates, and you just put it in a Dappen dish. Before, a long time ago, we used to have it in a Dappen dish, the type of disclosing agent, but now it's in the Q-tip, so. Okay, next topic, brushing. The type of brushing technique, you can use your handout that I gave you if you want to look onto this diagram. It's called the modified Bass technique. Mine's in color, yours is in black and white. This one. Now when you want to brush using the Bass technique, the main thing that you have to know is to have your toothbrush at a 45-degree angle towards the sulcus. So what that means is you're not going to hold your toothbrush like this and go like this. You're going to, you see how I twisted my wrist a little bit? See how the bristles are facing up a little bit like that? You see? It's angled. It's not like this. It's not flush with the tooth. It's angled towards the sulcus. Can you see that? So you're going to vibrate and use short strokes. So you're going to go like this around. Can you see that? How it's angled up? You're going to do like about 10. You're going to brush for 2 minutes. And then we're not just going to brush, you're going to roll it down after. Because this whole surface has to get brushed too. So after you brush with a 45-degree angle, you're going to roll it down. 45-degree angle, roll it down. Then you roll it down. Then you roll it down. Does everyone get that?
You don't brush in like circular.
You don't brush in circle. There's the different types of brushing techniques. This is how this is called the Bass technique of brushing. There's more techniques that you're going to learn in Professor Spencer's class, but this is the type. It's called the Bass technique. You put the toothbrush at a 45-degree angle, and then you roll it down after. And when you brush on the inside, the lingual surfaces, you're going to put your toothbrush like this, and you're going to ask the patient to go up and down. Okay? And same thing for the lingual of the anterior teeth, up and down. But when you do the linguals of the molars, you're going to do the same thing. You're going to angle the brush at a 45-degree angle towards the inside, just like that. The same thing as if you were to do the buccal surface. So the same way we're going, you would angle it 45 degrees towards the sulcus, and then you would go, on the linguals you go up and down for the anterior teeth. Does everyone follow? 45-degree angle, and for the anterior teeth and the linguals you go, you just flick the wrist like that. Always point the toothbrush at a 45-degree angle. That's the whole thing, 45-degree angle, 45-degree angle. Okay, yes. You had a question?
Oh, no, I just have an
Oh, okay. Any questions? Yes.
How long do they stay in recording in each section?
Well, you can stay in each section for about 15 seconds. As long as you brush, it takes 2 minutes, 10 seconds, 15 seconds every couple of teeth, 10 to 15 seconds. It takes 2 minutes to brush the whole entire mouth. And then when they brush their tongue, they use a sweeping motion. And that just shows you how the toothbrush is angled. You see how the toothbrush is angled towards the gum line? Okay, I'm going to show you how to floss now. And I'm going to need a volunteer. I just need your hand. I just need your hand. I just need your hand. I don't need anything. I just need your hand. Okay, now let me floss. If we're going to pretend that these are her individual teeth, each finger is an individual tooth, right? And this is the interproximal interdental space between each tooth. So say this is the mesial wall of one tooth, this is the distal wall of another tooth. So when you get the floss, you're going to get it about 18 inches, say. You're going to hold it with your thumb and your middle finger, and you're going to wrap it around your middle finger, just like that. and then you're gonna use your thumb and your forefinger and you're gonna grab it like this, okay? Now, some people think that when they floss, they just go like this, and that's not how you floss. When you floss, I'm gonna have, see how she separated? Usually the teeth will be like that, but I'm gonna have her separate a little bit so you can see what I'm doing. When you floss the teeth, you're gonna slide the floss down one wall of one tooth, slide it down, and you're gonna wrap it like a C, then you're gonna go up that same wall, and then you're gonna go down the same space, but now you're gonna touch the opposing wall of the other tooth. You're gonna wrap it like a C, you're gonna go back up. So you're gonna do the same thing. You're gonna go down one wall of one tooth. You see how I hooked it like a C to it? And then you're gonna go back up, slide it up the same wall. And you're gonna go down the same space. So you're going down each space twice. You're gonna slide it down. You're gonna hook it like a C. The only reason I'm saying hook it like a C because there's the interdental papilla. Obviously she doesn't have that on her finger, so just imagine it's there. So you're gonna slide it underneath. You're gonna go back up. Does everyone follow? Okay.
Can I just interject?
Yes.
Sorry.
Go ahead.
Do you show them how, bring your fingers close? Do you see how many strokes do you do on the tooth before we come out? This one.
You can do a couple of strokes on the tooth.
You need to hear a squeak.
Yeah.
First time you won't hear anything, second time you won't want to listen to squeaky clean, and it's time to come up and over and wrap the other.
Are we using the same portion of the dental
Nope,
floss? Moving it.
you're gonna wrap it around, and then you're gonna see how a fresh new piece came? And then you're gonna wrap it around, and then a fresh new piece. Okay? There's also a diagram in the handout that I gave you. And at the end of the last page, there's some questions that you can ask your patients when you're giving patient education, just to get the conversation going. What's your current at-home oral hygiene routine? Can you show me the way you brush? What surfaces do you brush? How many times a day do you brush? With flossing, can you show me the way you floss? You want to see what they're doing wrong, and then how long does it take you to floss? Okay? All right, so what Professor Spencer wants us to do is you're gonna work on each other, you're gonna disclose each other, and then after you're disclosing, you're gonna practice the brushing. You're gonna brush the disclosing off using the best technique that I just showed you. And then if you want to practice with some floss on each other's hands, or if you want to practice with some floss in your own mouth, you can do that as well. Okay?
So they're gonna sit in the chair, just go with their partner,
Yeah, and then they're gonna switch.
but the partner's brushing their own teeth.
They're gonna brush their own teeth. After they're done, then they're gonna brush their own teeth. Each person brushes their
Do
own
we
teeth.
show them how to brush before the brush?
Yeah, they're gonna also do the plaque score. Yeah, you have to fill this out as well. So disclose, plaque score. After you do this assessment, then you brush your own teeth, and then you practice flossing if you want really quick, and then you switch.
Where are you brushing and spitting out? Where are you expectorating?
The cuspidor.
Yeah, you don't use these sinks, all right, even though you wanna get it off and get a really good running water, no. You have to put it in there, sorry. You have to get those